My name is Anna Mette. I represent My Personal Health Bank. I'm co-founder. And we have built a patient-owned app that will support the collection and the storage and the demonstration of healthcare data. We spoke a lot about the access to healthcare, but that's very good. But we also need to optimize our resources in a way that we could do that by having healthcare readily available whenever we need them. So the patient would actually be able to show these kind of healthcare data to whoever might need them, healthcare providers, and so on and so forth. The situation today is in many developing countries and also for people on the move that they don't have these data. Potentially they do have them on a piece of paper that might get lost, it might get burned, it might disappear anyway. It's also very accessible for other people, so it's not a very safe way of storing it. The challenge is that when you're on the move and when you're living in developing countries, having these kind of data, it would actually mean a huge difference to the healthcare providers, but also to the patients in order for them to be able to actually take responsibility for their own healthcare. So actually, while we have to ensure the transparency and also the availability of that data, which can be done by a mobile device and application that we have developed and that will go into test in Tanzania in January next year. The solution is that we could have that data available, shared with the caretakers and the healthcare providers. We'd make sure that the data would actually be available to the patient whenever he or she will need it. We already know that mobile technology in both developing countries and many places else is already widely used for a number of areas where you need to get an access with the authorities. Also, we could actually provide this electronic patient journal to NGOs, to government who would be able to use the data in order to provide the right care at the right time, do provisionary statements, do predictive care, make sure that the resources are available whenever needed. All of this can be used for maximum, I would say, 10 euros a year. You would purchase a license that you can actually go out and then give to the patients, or you could give it to the healthcare providers. It is a floating model, so the more licenses you purchase, the cheaper it would get. Our customers would be the government, regional healthcare providers, NGOs, or insurance companies. We have looked into the numbers, and with a reasonable availability, we think that we could actually reach in 4 years' time almost 4 million euros. This is one country, and the country of where we're going to test in Tanzania. Of course, data security is a major issue. We have also made sure that we actually fulfill all GDPR rules and so on and so forth. We are looking for partnerships in 3 areas, both money, but also partnerships for testing, and we are looking for local partners for maintain and support of contracts. We have to do this to make safer care and more efficient. Thank you very much for your attention.
Thank you. Panelists. Anyone jumping? All right. Let's get it started.
Let me focus on one point in your presentation, or on one point of the feedback. What was not mentioned in the presentation, but what would be extremely interesting for an organization such as the Red Cross as a partner even, and that probably was the first pitch tonight where you really made me think, okay, how can we partner up with this idea, was the fact that there's so many thousands of people migrating all around the world, and this is exactly what is a huge problem, that health data is not available whenever, people on the move need health support and health services. So that's something which there's a huge demand only from that perspective, only from, looking at migrating people and the support they need. So that made me really very interested, and yeah, that's all I can say. The rest, I loved it. Gave me all the figures and data, but it really made me think. That was great. Thank you.
I'm here the rest of the evening.
Yes, exactly. I just wanted to say, let's catch up afterwards with a drink.
The first pitch, you actually had the target audience in the room. Any other comments? Yes.
I'll say, great solution. I really like it. And one key thing that I want to say is I would love to continue talking to you. And I think Tech2Impact can definitely support you. And so I invite you to join Tech2Impact, because this is exactly the founders we work with.
Likewise. Thank you very much.
When you say you really like, what do you like about it?
I think the impact that you can create with that on so many different levels, from what you mentioned to actually more individual use for people on the move, is amazing, and this is a very high potential solution, and I think many big NGOs can definitely partner with you. So it's good solution that can be really good implemented.
If I may
Thank
just
you.
add one little thing, I mean, most decisions today that we make in all aspects, also in healthcare, is based on data. In developing countries and also for people on the move, decisions are being made by anticipation, by assumption, or by new testing. So you spend a lot of money and a lot of time trying to treat that patient in the right way, but you can't start the treatment in the proper time potentially, and again you do testing that was potentially done 2 weeks before. It's just a simple thing as knowing the blood type. If you travel from A to B, you can't remember what your blood type you are, then you have to take it again. It costs time and money every time. So again, access to healthcare can also be provided to more people if you have to do less testing and you have a better starting point. And that's how we really see this could support NGOs as well.
Thank you, Annemette.
Yeah, sorry, shut up now.